and welcome to Straight Talk with PAP. I'm Yvonne Chan. The COVID-19 pandemic is the worst crisis the world has known in a generation, proving more complex and prolonged than previous crises. And how we respond right now will determine Singapore's future. Joining today's conversation is Minister Lawrence Wong and PAP's new candidates, Dr. Tan See Leng and Quan. Welcome, gentlemen.
Thank you.
Now, we're going to take stock of our efforts over the last 6 months, as well as look ahead at what next in our continuing fight against COVID-19. Minister, Singapore's response to this highly complex crisis has been multifaceted. Could you give us an overview of what's been done over the last 6 months?
Sure, Yvonne. As you mentioned just now, this has been a crisis of a generation. It's the worst crisis the world has faced in decades, maybe even in 100 years. And you can see from the experiences in many other countries how devastating the consequences can be, particularly when the infection spreads very quickly, people get sick, and the hospital system gets overwhelmed. When that happens, many people die from the disease, particularly the seniors who are most vulnerable. And even today, the number of cases in the world is continuing to rise. This is far from over. The total number of cases now is something like close to 12 million, and it's not plateauing. It is continuing to rise at a continued sharp rate. So over the past 6 months, since COVID-19 first hit our shores, we have been fully engaged in this fight against the virus. We set up the task force, we mobilized everyone in the public sector that's responsible for crisis management, but also many others, thousands and thousands of people in the front line and fully engaged in this fight. We've had our fair share of challenges along the way, but I think working together as a team, we have been able to overcome these challenges and we've made progress. So if you look at our situation today, we have been able to keep our community infection rates at a very low level. We've protected Singaporeans, particularly the more vulnerable groups, and our fatality rate is one of the lowest in the world. There have been cases in the dormitories which have created large clusters, but the minute this started, we mobilized a significant response to clear the dormitories, and it has been a huge effort. We recognized it early, we mobilized the SAF to assist in this effort, and what we have done to address the concerns of migrant workers is something that I think no other country has done. If you look at countries with large migrant worker communities, they have had infections too in these communities, but no one has mounted such a strong and significant response as we have to test and clear all the workers systematically in the dormitories, to build in very short time ancillary health facilities, significant ones, to take care of all of them and therefore to keep their fatality rates low, to ensure their well-being beyond healthcare, but also for their daily needs, in particularly their food, and ensuring that they continue to be paid throughout this period. It's a significant humanitarian response because we recognize that these workers are an integral part of our community. So that's what we have done through these 6 months. It's been a massive effort, and I should highlight that as I said earlier, it's an effort that involves many members of, many Singaporeans, both public and private sectors. And that's why today I invited 2 of our new candidates who have been involved in this fight and have been in the front line of this fight against COVID-19, Quan and Dr. Tan See Leng.
Yes, Dr. Tan See Leng and Quan, we have so many questions for you tonight. Maybe I'll start with you first, Dr. Tan See Leng.
Sure.
Minister talked about mobilizing significant resources to get things done, and you were there on the ground. Can you tell us what was that like for you?
Well, I think it's a huge and quite a mammoth exercise, I must say. When I was approached to assist, this was sometime in early March, when at that particular point in time when it was just beginning to sort of see 1 or 2 of these spikes in terms of the infection itself, the planning the thinking that went behind it was actually quite mammoth, but at the same time very organized. And I want to sort of take this opportunity, if I may, Yvonne and Minister Wong, to also put on record the fact that while we have our healthcare workers at the front line, and they are really, truly our heroes, and we really sort of take time to recognize them and to really thank them for the huge amount of efforts and the risk that they take in putting themselves at the front line. There's a reality, the other reality is that there's an entire ecosystem of companies, of people supporting them from different backgrounds. You have architects who've gone on to design, engineers to build the facilities. We've got people who are working behind the scenes to frantically call and reach out to contacts all over the world to procure masks. And I can tell you that some of the masks that we procured at source were found to be faulty. So we had to reject them. We had to find alternative sources to make sure that these are of the highest grade, the highest quality, to protect our entire chain of healthcare workers at the front line. On top of that, procuring the UTM, which is a universal transport media, the tubes that when you do the swab, you put it in. And there was a run on this kind of supplies to even the reagent that you use to extract the RNA. This is an RNA virus. You need to break down the wall of the virus to extract the RNA out, right? And you need primers. And at that particular point in time, when we first started, there were only a handful of companies producing this. So you can imagine, right? Behind the scene, there's this huge amount of effort. There's a lot of people involved in this thing. To the housekeeping staff, the cleaning staff that cleans up the facility, sanitize it, disinfect everything to prepare the facility so that the next day when the healthcare worker comes back. So this is really an all of Singapore united, coming together and really working. And I mean, what we see in the daily articulation and the daily comms, the announcement from Min Wong and Min Gan, in terms of how the numbers, the statistics have come up, and the advisories, we are only seeing one aspect of it, right? But behind the scene, there's all that coordination. So you can imagine that, I mean, the amount of work. So I've been involved in really organizing the COVID task force in terms of the swabbing part, and we have recruited. We are also mindful of the fact that we do not want to burden the public healthcare system. So we mobilized all of the private sector people to come on board. We got doctors, we've got nurses from the private sector. We train healthcare assistants. On top of that, we even recruited dental surgeons to help us in terms of doing the swabbing. So it's really a very systematic, but quite a mammoth exercise. So even as we speak now, we have set up on-site testing at different spots all over the island so that when the workers, to even the at-risk exposed individuals, when they come into contact, these are sites that are dedicated sites that people can go and do the screening at. So as we speak, it's still an ongoing exercise.
Yeah, we mustn't forget that the fight is still ongoing, even though we are getting deeper into phase 2. And what you've just shared, Dr. Tan, that is a massive mobilization exercise. I didn't realize dental surgeons were also roped in to help with, these frontline operations too. Yao Chuan,
if I may just interject before Yao Chuan says.
Sure.
I liked what Leng described it because, I keep trying to convey this as best as I can, that it's an immense effort. And words do not do it justice. To say the word significant, massive, immense, those are just words. But you hear stories on the front line, people like Leng, and the whole ecosystem that is backing this effort. It is truly a tremendous SG United effort.
So good to know that. Thank you, Minister. Yao Chuan, you are also right there in the thick of things at the front line, and you're very much deeply involved in the community care facilities. Can you tell us more?
Yeah, so I've been leading some of the frontline operations in both the dorms and also the community care facility. And I think for the benefit of our audience, a community care facility is basically this massive facility, each with a capacity of thousands of beds. And what it does is to take COVID positive patients who are otherwise well and who don't need a hospital stay. And so these facilities are meant to complement our national healthcare capacity and ensure that our hospitals do not get swamped with COVID positive cases. I've been involved in setting up of a major community care facility. In fact, we took in our first patient on Friday. I obviously couldn't be there because I had to take leave to be involved in the campaign, but my teammates have just successfully opened that facility. So to echo Minister's point, this is far from over. We're still setting up major facilities like this, right? And we have to scramble that capacity of thousands of beds in a matter of weeks. And to echo what both Leng and Minister Wong has said, this is, I think the best way to put this is that this crisis, this unprecedented, ambiguous and rapidly evolving situation has brought out the best of Singaporeans and Singapore society. You see public service, you see public sector officers coming together, and it's not just frontline healthcare workers, but the SAF, Home Team, various agencies, right, coming together, working flat out, but no fuss to meet almost impossible timelines, right? And you have private sector partners, non-profit organizations coming in, and in a matter of weeks, we got the facility up. So it just brings home the point that the crisis really, when there's a crisis, Singaporeans and Singapore society rise to the occasion. I will also say that in this community care facility, we have hired fresh graduates who otherwise were trying to find a job for months and weeks since graduation, and we created temporary positions to get these fresh graduates to come in and help us run operations.
Okay.
And so I think it brings home the point that we've said so much that this crisis is about both lives and livelihoods. And I think you see that kind of crystallized and that coming together in that community care facility. It is about keeping Singapore safe, protecting lives, but at the same time, using that as an opportunity to create jobs and to create opportunities where people can pick up skills and relevant experience, and hopefully, at a later point in time, they can take that with them to apply that to wherever their careers may bring them. So for me, that was a really key learning point.
Absolutely. Could we perhaps see the rollout of more community care facilities and the training of fresh grads or other personnel who might want to come in and support in these areas?
For sure. I mean, I think it goes beyond community care facilities in the sense that because the fight against COVID-19 is not over, we will continue to need to roll out a full range of responses and to be able to implement all of these programs and responses well, we will need manpower. That's the key. So there will be jobs that we are looking to hire and fill. It goes from people who are doing the swabs to people in healthcare, people in the laboratories that run the test. A whole range of people we will need to train and be able to deploy in order to ensure we have a sustained and strong response to COVID-19.
How do we continue to ensure that our healthcare system is still ahead of the curve, because new information about the virus is still emerging and we have yet to develop a vaccine for it?
Well, our researchers are involved in this global effort to develop a vaccine. There has never been a time where such a global response has come together to try and find a vaccine. I think this is the first time ever that you have so many parallel efforts, more than 110, clinical trials or development projects taking place, all at the same time. And our scientific community, our researchers, are well involved in many of them, trying to find breakthroughs, doing the trials to see which one is more effective. We are also talking to pharmaceutical companies to see if vaccine manufacturing can be done in Singapore itself, because we do have a strong pharmaceutical industry. So we are continuing to keep pace with the research, with the latest scientific developments, and also being part of this search for a vaccine, which we know is key to eventually allowing some life to resume as per normal. But even then, I must say, we should be very mindful. It's fraught. This whole search for a vaccine is fraught with challenges. Finding a vaccine is never easy, and
time-consuming.
It's very, very challenging. And even if a vaccine is found, one does not know if there will be long-lasting immunity to the virus. So there are still uncertainties ahead. And Leng might very well elaborate on this as
please.
a doctor. He knows full well the challenges.
Well, Min Wong is absolutely right. The strange thing about this particular virus, many virologists and infectious disease physicians, in fact, in the early part of the year, have also gotten it wrong. Because, in fact, if you go back to many of the news reports in January, I mean, I'm particularly interested in, obviously, in medical field because of my background.
Yes.
So, in fact, there were many people who felt and thought that by June, July, when the weather gets hotter and the summer season comes, the virus will blow over. But you can see that, as what Min Wong has said, you go by the worldometer, we've hit 12 million, and it continues to climb exponentially.
Yeah.
So I think one innate nature of this particular virus, and I don't pretend to be an infectious disease physician, but the fact is, as all viruses, they undergo mutations. And it keeps shifting its structure. So regardless of the type of vaccines that you develop, it's just like the flu vaccine, right? Every 9 months or a year, you go for a jab, because they got to keep changing. And I mean, new studies have come out to say that there is, I think, just in between my running around in the hustings, when I have this, I get these updates and so on. They found a mutation of this D614, where now they're thinking it could be even more contagious. So, but whether it is more fatal or not, we still don't know. So in the midst of development of these things, there are all these changes that's going on. So I guess I'm a bit more reserved in terms of my trust as to whether a vaccine can be sort of developed before the end of this year. Sometime next year, I'm hopefully optimistic. I don't even say cautiously optimistic. I'm hopefully optimistic. But then again, you still need to, I mean, if you're thinking about rolling out for 3.6 million Singaporeans plus another 2 million people here, the 5 million people.
Yeah.
I think to put that burden on Min Wong and Min Gan to say that this vaccine is safe to go out to 5 million people in a very short period of time, I think it's going to be a very tall order on anyone in that field. I mean, you look at some regional countries when they wanted to try I think it was the dengue vaccine, and it's resulted in a lot of deaths.
Yes.
So I'm not being an alarmist, but I think it's better for us to be safe. Yes, that's right.
Because I think there's a lot of enthusiasm and excitement now that, even places of attraction are slowly being opened in Singapore, cinemas, and everybody can't wait to get into phase 3. But of course, there's still some
Can't
people...
wait to get into phase 3.
Yes, of course. This is what I'm hearing from the ground. Everyone's like, when is phase 3 coming? Although Minister Gan did say the other day that phase 2 will last with us for some months. We tried to get him to quantify the number of months, but by the looks of it, phase 2 could maybe last till next year at the earliest.
No one can tell, because phase 2 will include potentially a review of many other measures that we currently have. We just had a press conference today where we highlighted that since the circuit breaker, we have seen a slight rise in the numbers to be expected because we know that as people move about, there's the chances of the virus spreading is higher. And so we were mentally prepared for this. But many of the community cases that we have observed so far, the linked ones, the transmission happens in households, which is also to be expected because if you are infected, you are very likely to infect also your household members who are living together with you. Not so many have happened through social interactions, very few. This is quite unlike the situation before the circuit breaker. Remember, before the circuit breaker, we had huge clusters in religious settings, in Safra, and these were social gatherings. We have not had that so far, and that's precisely because we've not allowed social events to happen, right? We've not had, large gatherings. Yes, we can go out and dine, but we say every table up to 5 people. You can visit, but again, there's a limit. So those social restrictions are in place. I think there is a lot of interest to relax those social restrictions.
I believe so.
To dine in larger groups, to go out in larger groups, to have, large banquets, dinners, but we will have to be very careful in thinking about these steps because the minute you have large social gatherings, then the concern is it's not just one case, but one case leading to multiple cases, leading to large clusters, which will be very, very hard to ring fence and isolate when it multiplies so quickly. So we are watching this. That's why we say it's months, and it's very hard to quantify the timeline. But we should be mentally prepared that life is unlikely to go back to what it was before the circuit breaker. This is a new way of living for quite some time to come.
Well, Minister, if I can just jump in here, and Yvonne, to your question as well about how the healthcare system must, how can we stay ahead of the curve? I think the point is that we don't know if or when that second wave may come, right? And so, at least from my perspective, as an administrator in the public healthcare system, the central challenge for public healthcare in Singapore is, in this phase, is really trying to find that balance between resuming services for non-COVID conditions, because people still get sick from a whole range of conditions. That doesn't stop, right? So it's balancing between that and retaining the capacity to handle that second wave if or when it should come. And so Leng spoke just now about getting mobilizing dental surgeons to swab people in the community, but dental surgeons ultimately need to go back to do dental surgeries. So that's really the fundamental challenge that the public healthcare system is trying to manage. And I would say also that the key success factor really is just agility and the ability to, or just that tenacity to deal with uncertainty and a very ambiguous and rapidly changing situation. And I think we have to continue that posture.
So maybe to add on,
Yes, Dr. Quan.
I think what is very telling from working with the healthcare workers in the front line, the spirits and the morale, they're actually quite high, right? I mean, here they're screening. On a given day, we were doing at a peak, we're doing collectively about 2,000 to 3,000 screens a day. And you can imagine, right? You are all gowned up, right? And it needs to be an open hall. It's actually very, very hot, and you dehydrate quite easily. But in spite of that, the morale is very high. I think the main thing is the confidence that our frontline healthcare workers have. In a sense, two things. Number one, they are well protected. The full PPE, you make sure that the best quality, the protection is given. And the second thing is they know with confidence that if they should catch the bug, our healthcare system will care for them because they are not overwhelmed. And that is the key function of what the task force has done to make sure that the healthcare system at any particular point in time, yes, you can stretch, it's stretched, but it's not overwhelmed. Now, the moment you hit breaking point, and if it's overwhelmed, then I'm not sure whether, I mean, obviously from the passion, the conviction, and the commitment to do good is still there, but people will start, the fear will then come in. But that fear has not, at any particular point in time, crystallized. I think that's very important, right? The third point to Yao Qian's thing is that we also made use of the opportunity where we actually do sort of self-made videos to now train some of these people. We have self-test kits where we actually show them how to do the swab yourself. So eventually when the doctors, the nurses, they go back to elective surgeries, the dental surgeons doing their own thing, we are now training a new group of people to do self-swab. The innovation has now gone on even to saliva testing. So things are moving, right, to continue to ease off the demand and the burden on healthcare workers.
Yeah.
So it's a very fine balance, but I wanted to talk more about how else is Singapore poised to fight COVID-19 in the areas of innovation. I think there's a lot of interest there.
Well, indeed so, and I would say if you think of, if you first, just before we touch on innovation on the subject of the healthcare system, because of the significant buffers and reserves that we have built up through the CCFs, the community care facilities, the ancillary facilities to look after patients, even expanding our ICU capacities, we are in a good position. I mean, we have all of 2 patients in ICU now for COVID, not like the numbers we had in the past. So we have the buffers. Even in the community care facilities, the numbers have come down because more and more workers have recovered, and the outflows, the discharges are now far exceeding the ones coming in, which is a good situation.
Yes.
So in fact, we have been able to give the doctors a much needed breather. They don't have to be mobilized all the time looking after COVID patients. They can reschedule, readjust their schedules, and then the amount of time they need to spend in these COVID operations can be significantly reduced because today's needs have come down. But we still have the reserve capacity, and as Yao Chuan says, the nimbleness and the agility to move quickly is there. Of course, we really do not want to have to use the reserves if we can help it.
Yeah.
I mean, building reserves doesn't mean we must
use up
everything.
Yeah.
But the capacity is there, and we can move quickly to activate them if needed. And the other key, as Leng says, is this whole crisis, because necessity being the mother of invention, because of that whole period of tightness when people were scrambling, we've seen tremendous innovation happening from having doctors doing telemedicine, for the workers in the CCF. The doctors do not always have to be present. They can use a kiosk, and then they can provide advice to the workers on how they go about getting treated. The use of innovating around different kinds of ways of doing the swabs, because the current method to stick something up, the nasal swab
it's a bit invasive, I suppose. It's not very comfortable.
It's not very comfortable. It's not very comfortable.
Yeah.
To do it once is fine, maybe, but we are subjecting some of these workers and higher risk groups to periodic swabs every 14 days.
So painful.
So that's not something very pleasant.
Yeah.
We need to do it for their safety, and they understand.
Yes.
But if we had a better way of doing the swabs, better, that meaning it's more convenient, it's less intrusive, but also ensuring that the test is sensitive and reliable. And one of the difficulties has been, the reason why we've not been able to move with other types of tests is that so far the evidence has been that it's not as sensitive and reliable. So you can try different types of tests that are less intrusive, but if it's not a sensitive and reliable test, then it defeats the purpose. So a lot of innovation, a lot of experimentation and testing is being done now in this particular field. That's just one example. Many other areas. I met some of the healthcare professionals at Singapore Expo, and they said They have been collaborating with their IT departments on many of these new methods using technology, and they said it's been a wonderful collaboration from their point of view too. They have never seen their IT departments being so responsive to their operational needs before. So that's another, you've got innovation, you've got collaboration happening within the hospitals, within the public hospital clusters, and also between public and private sectors. So that's that kind of spirit that we will need to be able to fight COVID-19.
You know what they say, never waste a crisis.
This is an important point.
Yes.
Having said that, because obviously we are live and it's being recorded, it's broadcast to many. We don't want to also create fear. It is uncomfortable, but it's very safe. So,
Yes, indeed so.
So we don't want people to after that stop testing because
very true.
It's uncomfortable,
Very
but
good
it's
reminder.
very safe. It's very safe.
Uncomfortable, but it's safe, and it's
Yes.
good. It's best for your well-being to get tested that
Actually,
way.
Minister,
Yeah.
can I just make one quick point?
Sure.
And I thought I had to make this point because I don't think it's been made enough. Minister, you spoke about reserve, right? That reserve capacity. I think the other side of that coin is when you have reserve, you need to keep your powder dry. You need to have enough powder, right? So I think the point is personal protective equipment, PPE, it works, right? But I think the point that is underappreciated is our healthcare workers never had to worry about a shortage of PPE. They will always be protected, right? And it actually doesn't happen by accident. To have that constant supply of PPEs for our healthcare workers so that they have the confidence to go out there and do what they need to do. There's going back to the point about ecosystem, there's a whole ecosystem to make sure that happens. And it's not just about PPE, but about drugs, about consumables, about a whole range of other
Even
supplies.
food.
Exactly, right? That is needed to keep the system going. So it really is a massive operation, and yeah.
I can tell you're really proud of this SG United spirit as well.
Absolutely.
To see so many facets of society, private and public sectors come together. I'd just like to give a shout out to our online viewers that if you have any questions for Dr. Tan, Yao Quan, or Minister Wong as well, please leave them in the comments section and someone will field it and we will answer them as soon as we can. Thank you. Gentlemen, I'd like to move on then to the second part of this conversation, and that's to really talk about what else we can do to fight this virus, because it's going to be a long-standing one. So I understand that the government has very generously given out masks to our citizens. We've got sanitizers, and now we've also got the Trace Together tokens, which were just given out very recently to 10,000 seniors. So how will this really work to help curtail the spread of the virus?
Well, don't look at the tokens in isolation, but look at it as part of a broader system of very fast contact tracing. And contact tracing is essentially a human skill. That's why our starting point was to beef up the team with officers from the SAF, from the police, strengthen it considerably so that they can do quick contact tracing. Then technology comes in to help them because with technology, you can do the activity mapping. Contact tracing is about activity mapping. Who have you been in contact with for the last X days? And if I were to ask you, who have you been in contact with, you could look at your handphone, you could look at your diary, you could think through, but it will not be perfect. No one's memory will be perfect. But with Trace Together, be it as an app on your phone or the tokens, then we have better information to complete the activity maps in a very short time. And even today, where we are today, we have been able to, with humans, with the beefed up team, and with the Trace Together app and the tokens, we have been able to get the activity maps done very quickly and to issue an electronic quarantine order within a day of notification. I know a case is up, I map out who the person's contacts are, and I quickly issue electronic quarantine order on your phone so that we can immediately isolate, get these people to stay home, don't go out, and then we move in thereafter to test all of them. So it's a whole new operation of going in quickly, tracing, very, very swift tracing, and then testing all of the potential contacts and suspect cases in order to pick up any possible infection. That's a capability that we have, again, painstakingly built up. Behind the scenes, people don't see it, but it's been built up over the last few months, particularly through the circuit breaker period. That gave us some relief because we didn't have to go out and do a lot of contact tracing then. The number of cases came down. We used that period to build up this capability, and now we are able to mount swift responses each time a new case is picked up. This is also the reason why you do see a bit of an increase in cases in the recent days and past week or so. It's partly because each time a case is identified, we do a very comprehensive sweep, and in the process, we pick up more cases, which is a good thing. It suggests that we are testing more and we are proactively picking up more cases in the community before they spread to other people.
You said to date, the number of people who have downloaded the Trace Together app was about 2.1 million.
That's right.
And we need more people to download this app for it to actually work more effectively, right? So how can we raise awareness that, hey, Singaporeans, people living in Singapore, let's download that app and so that we can trace better together?
So we really need to just continue to get people to understand this is really for your own safety and for the safety of your loved ones, because anything can happen. And if you happen to be a case, or your friend happens to be a case, you would want this system to be in place so that you can be notified very quickly, and then you can get identified, you'll be notified and tested, rather than you not knowing, potentially being what we call a cryptic infector, because remember the virus incubates and you are infectious before even you show symptoms. So you may very well be carrying the virus in your home, spreading it to others in your family, worse to someone who is senior at home, for which then the consequences will be devastating and lethal. So downloading the app, and eventually if the tokens are available, having a token, it's really for everyone's safety.
Dr. Tan, you've talked about how the virus has been mutating, right? Can you tell us how maybe we could better identify an asymptomatic carrier? Because that's the problem with this virus. 14 days, you just have no idea whether you're infectious or not and who you're in contact with.
So the asymptomatic carriers are very difficult to identify because they have no symptoms, right? The way you talked about it, sometimes you wake up, we all get a bit of sniffles in the morning, right? Maybe a bit of a parched throat because you switch on your AC and you breathe through your mouth. It's very common. And then, after 1 or 2 days, it just clears, right? So you don't think too much about it. But these are what we call asymptomatic carriers, right? And we pick them up after a while when you do because we've done quite a lot of screening. Suddenly we find that they're positive, but there's also the antibodies, the IgG is also positive. That means we know that it is it's an old infection. What Min Wong is talking about, there's a group of people who are pre-symptomatic, meaning that they will develop the symptoms. So there's asymptomatic people, there are pre-symptomatic people.
Who are these people that are pre-symptomatic? I mean, is there
So those are the ones that we're really targeting, because we know that the moment, and the virus, many of the virologists say it's a smart virus. It's a very smart virus because, you have people with diarrhea and suddenly you find that, there are clots that's forming because of the viscosity of the blood changes and so on. And some of them get strokes, they get heart attacks and so on, right? Even after they've recovered, because it changes the clotting, the coagulation profile. So today, the contact tracing app at least provides you from the pre-symptomatic phase to when they develop symptoms, and then we pick them up, right? So one part of it, I think, covers already a huge sort of area of exposure. And it actually increases don't forget, right? It's also a function of when you do the testing. If I do the testing just after you've come into contact with someone, the likelihood is that it'll be negative.
Right, yeah.
Right? And I got to wait for maybe 24, 48 hours or 3-4 days before you turn positive. So at least you have this contact tracing app. It improves the yield. I mean, the reality is that, yes, many more companies are producing test kits, but the gold standard, there are very few of these companies where you have this kind of very solid, accurate, precise, highly specific, and highly sensitive test kits. What you want to do, I mean, the test kits that the ministry here use and the private sector uses, they actually have specificity and sensitivities in the high 90s.
Okay. Right.
Right? So you don't have false negatives. Right? I mean, it's important because if you have false negatives, then you tell the guy, no, actually you're normal. He goes around and he actually passes on to everyone. So therein lies this challenge. So at least with the Trace Together app, it actually helps us to improve the yield, right? And it helps us to actually risk stratify better.
Actually, if you think about the the Trace Together app, if you think about it, it's such a simple action, right? You just need to download it. And I think the larger point and really the key point is that amidst all that innovation and all that we're doing, actually the front line still remains as everybody out there. Everybody is the front line, right? And all it takes are really simple actions like downloading that app, like staying safe, like remembering a basic hand hygiene and not touching your face. Everybody is the front line. And at least from, again, my perspective as a public healthcare employee and professional, everybody says we are the front line, but actually we are the last line of defense, if you think about it, right? We depend on everybody to do their part, download the app, do all the precautions that are needed.
Personal hygiene.
Exactly, and when the cases come to us, they're confirmed. We manage the consequences of that, but really we depend on everybody to be that front line for us. So I think that's really the biggest point.
Absolutely. And as we get closer to the 10th of July, I think a lot of people are also quite worried about casting their votes safely in this new normal. What reassurances do you have for them as we're only 3 days away?
Yeah, indeed, that's something that even before, this is really what the elections department had considered very carefully. And before even deciding that it was, safe to proceed with an election, that they had looked at the situation, they had studied what other countries have done during this COVID-19 period. Korea and other countries have conducted elections safely, even in the midst of a pandemic. And that's why, after all these careful studies, the multi-ministry task force had put in place national guidelines. So the elections department took those guidelines and then developed a set of protocols for safe elections. And it was only when these were developed that the Prime Minister saw that this could be done safely, that he decided to call for elections. So the bottom line is this, that on the 10th of July, it is safe for everyone to go out to vote and cast their ballot, because in the polling stations, there will be safe distancing measures taken. A whole range of procedures have been taken to ensure everyone's safety and to make sure that everyone can cast their ballot safely. People do not have to worry about that. Those very comprehensive set of protocols have been put in place by the elections department. They've done so based on the national guidelines from the multi-ministry task force for the whole country, but they have also applied the lessons they have learned from looking at other countries. And the reality is that some people say when should the elections have been held, right? Yeah. But the reality is precisely because, as we said, COVID-19 is going to be with us for quite some time. So the reality is it will be held during the pandemic. You can't run away from that.
Yeah.
The elections will be held in this environment. The question is what protocols and measures are put in place to ensure that it's done safely, and I'm confident that the elections department has done so.
I'm actually looking forward to go to the polls on the 10th of July. I've got my polling card the other day and the time that was stipulated for me to go. I think everybody's going to adhere very closely.
So that's one of the many measures that they have put in place, where they give you a scheduled time so that you minimize the queues or avoid long queues.
Absolutely.
Yeah. I think to Min Wong's point, I have a LEAP series that I do it with the residents of Marine Parade every fortnight or so. So one of the title was post-COVID. So I was saying that I'm not sure personally, and if you ask many of my colleagues whether we will ever have a post-COVID, maybe sometime when all the vaccinations have come in, have come on and all the safety profiles and stuff have been well established. But I think until that period comes, I think we just have to learn to live with COVID rather than hoping for a post-COVID kind of. Like I said, people may think I'm being pessimistic, but I think that I'm just saying that let's be more pragmatic and realistic.
Living with COVID.
Yeah.
We talked a lot about this capabilities that were being done behind the scenes, a lot of things that people don't get to see. So the massive effort to put the Trace Together app together. Before I let you go, Minister Wong, I just want to ask, is there any other capabilities that's being built up right now to fight COVID-19, something that we don't know about? Or maybe we've already heard a little bit about, but we want some progress updates today.
Well, there's a whole range of stuff.
Yes.
Tracing is one of them. We've talked about this. Testing is the other aspect of it. We have been, ramping up our testing capacity, and as we've highlighted before, we have the capacity to test about 15,000 now, and we will be.
There's a goal to hit 40,000.
And we'll be getting
right?
to 40,000 in the coming months. We are on track to reaching that goal.
Okay.
40,000 is the amount of test capacity that you can do in any given day, but we can also do what we call pooled testing or batch testing, where you do multiple swabs, right, in one test, and that allows you to multiply 40,000 could become 200,000. Right? So that gives us the capacity to do a lot more testing. This testing is quite critical, and over the few months we have been really ramping it up. So we've stepped up tracing and scaled up testing capabilities. We are in a much better position today to control the spread of the infection. But really, as Yao Chuan said just now, the risk is we talk about these capabilities and then everyone starts to say, oh, okay, it's all right, you've got all these wonderful capabilities, your toolkit is so excellent, and I can heave a sigh of relief. Worse, I can start to,
relax.
Not just relax, but push the boundaries on the rules. And instead of keeping to 5, I start to play badminton with many people. I start to interact with many people. And I think when that mindset seeps in, no amount of testing or tracing will help. It's not going to if everyone is going to become complacent. So it's really, really important that we recognize government capabilities have improved considerably. We have continued to, it's not over, we're continuing to ramp up and step up these capabilities. But all of us, we really also need to do our part to take the necessary precautions, exercise discipline and vigilance, and change our mindsets to recognize that we are living in a new world. This is the new normal, and we all have to make adjustments to this new environment. Yeah. And it really takes that, SG United effort then for us to be able to adapt and succeed in defeating the virus.
Like I said, we are the front line, right? And we are already living in a COVID world. It's not when that post-COVID world would come. So as I wrap, gentlemen, I just want you to very quickly share with me then a valuable lesson that you've learned in tackling COVID-19 over the last 6 months. Maybe we'll start with you, Dr. Tan.
I think it's important to always look forward, because the virus keeps keeping scientists, doctors on the edge. There's a lot of new developments, and the key thing is, how do the virus is a very smart virus. How do we keep making sure we stay ahead of the curve by ensuring that we do the right thing? And we keep tweaking along the way, because we are always a work in progress. The virus itself is one of these, it's in the nature of the beast that you're dealing with, right? So as long as we keep moving forward, rather than keep looking backward, what we could have done, what we didn't do, I think we should continue on this trajectory, right? And make changes as we find new things about the virus. And to Min Wong's point, right? One of the key things about reopening our economy, our airport, which the ministry, both the task force, they're now significantly doing, is that the newer developments, we're actually shortening the turnaround times of these tests, right? We're using robotics to do the early quarting. It's an initiative with A-Star, where we actually shorten the time of the early quarting by about 50%, right? So that we can speed up this thing. And then new point of care tests are being developed. So perhaps next time when people come in through Changi Airport, we just do it there and then we do. So we keep looking forward. And I think as a country, as a society, right, as a people, this should bring out the best in us. Working together, rallying together, right? We have the leadership, right? And then we work to make sure that we transform, and then we leapfrog the rest in terms of coming up on top of this pandemic.
Thank you, Dr. Tan. Your Quan?
Well, Yvonne, I think for me, so I've been asked, how I think COVID-19 would transform the public healthcare system in Singapore. My hospital, we're in the midst of building a new campus, redeveloping our current campus. So we are thinking about how a pandemic-ready hospital in a post-COVID world, if I may, at such point in time, might look like.
Still very optimistic,
right?
yes.
Yeah, this is many years down the road, but actually, if you think about it, one thing that doesn't change and should never change is that ethos of service, right? That clarity of purpose and that sense of mission. Because ultimately, if you think about it, that's what will get us through the next crisis and every crisis, right? You can never predict what the next pandemic might look like. But to get men and women and that whole ecosystem that we spoke about at the start to just rise to the occasion and just fight as one and deal with the situation at one. Ultimately, it is that ethos of service that will see us through every crisis. So for me, my key takeaway is that we must strengthen this ethos of service. I think this will be a defining episode. We say this is a defining crisis of a generation, but I think this is also a defining episode that will cement our ethos of service in the public space.
Excellent. Thank you, Quan. We want to keep looking forward as well, and also build the kind of values that we want in a society that gives and comes together in a time of crisis, right?
Very much so.
Minister Wong.
Well, when I reflect on what has happened over the past 6 months,
yes.
I have no doubt that this is not just an ordinary crisis. I mean, we say the phrase as, throw it around like it's a slogan, the crisis of a gen. It's not. It's really a significant crisis, and I have no doubt that it will leave in its wake a very different world. You already see many signs of this. Geopolitics being impacted, trade, globalization, investment flows, all being significantly impacted. And some countries will emerge from this crisis more fractured and more divided. And you do see signs of that too, where the rich have access to medical treatments, hospital treatments, testing, but the poor may not. Or if the impact of the crisis falls disproportionately on certain more vulnerable groups, society gets fractured, and it may get fractured permanently. But I think there will be a few countries that can emerge from this more united, stronger, and with a stronger sense of values and a sense of service, more forward-looking, as Leng said as well. And Singapore must strive to be amongst this group of countries that can emerge stronger from this crisis. And that response depends on all of us coming together, rallying together, uniting together to fight the crisis as one nation. So it is really about SG United, and that's why we say this election is so important. The votes are important because it's not just an ordinary election, it's an election where the stakes are high and our future and our survival is on the line. So again, we hope everyone will understand what the stakes are about and will give us a strong mandate so that we can rally together and defeat COVID-19 together.
And come out on top.
Yes.
Thank you so much, Minister, and thank you, Dr. Tan
thank you,
and Yao
Yvonne.
Chen, for sharing your insights with us today. And of course, to my fellow Singaporeans, if you haven't downloaded the Trace Together app, it's not too late. Now's the time. It's time to stay safe. And of course, don't forget your personal hygiene in the meantime. Thank you so much for keeping us company tonight. And a big shout out to our online viewers too for all your likes and your thumbs up. You've been watching Straight Talk with PAP. My name is Yvonne Chan. I'll see you tomorrow. Stay safe.